Hello, how are you? I'm so glad you're here. In this video, I'm going to talk a wee bit again about other non-pain persistent symptoms. That last day we had a wee chat about fatigue as being a common persistent symptom. So I thought again we'd talk a bit more about other symptoms that aren't, they may also have pain along with them, but aren't directly pain as such. Today then I thought we'd talk a bit about bladder symptoms. Now, bladder symptoms are very common. A lot of people do have them. I don't know the numbers, but I think it's, certainly say from my experience, it's quite high. And often various names are used for different conditions that are associated with bladder. But the most common one that is used when there isn't anything pathologically found or there's been no abnormalities in particular found is an irritable bladder or an oversensitive bladder, or interstitial cystitis is another term that we hear a lot. So in all these cases, most tests will have come back as normal. So there might have been lots of different tests done, scopes and urine tests and scans and what have you. And sometimes they might find odd wee bits here and there, but for the most part, if people have been given these diagnoses, it's because there are no structural abnormalities found. Yet the person will still have quite significant symptoms, which can range from frequency of needing to pass urine, urgency, needing to pass urine straight away, and pain. Although we're talking about conditions other than pain, as I said, is often associated with pain along with a lot of these other symptoms as well, and certainly with an irritable, sensitive bladder or an interstitial cystitis, then pain is a feature that people will report, but it's not the only thing they'll have. They'll tend to have other symptoms as well, like the frequency or urgency that goes along with it. Now, why would these symptoms develop? Well, I think when we think about the bladder, then it's not really surprising that that's quite a common symptom that can relate to neuroplastic issues. If you think the need to go to the toilet is quite a basic need, isn't it? It's something that we really need to be able to do. And it's certainly something when we know we can't do, makes us quite panicky. And there could be various reasons why that becomes an issue. It may have been from childhood when you're always told to make sure you go to the toilet, or you might have had an incident when you were young, you weren't able to get to the toilet. It's quite a common thing that children report, not allowed to go to the toilet at school. Or again, we're told, oh, you can't possibly need to go again. How can you possibly need to go again? You've just been, or well, you can't go just now, or whatever. So there's a lot of issues around there in terms of feeling safe and in control. In addition, there's also quite a big social aspect in relation to going to the toilet, in terms of if you don't go when you need to go and you have an accident and you wet yourself, then socially that's quite a big deal. Obviously, it's something that most people are very embarrassed about, and it's certainly not something that we probably want to do. So it's got a lot of fear associated around with it there as well. So it may be that sometimes things start off with, it could be something starts off with a simple urine infection, or a situation where we use the toilet, or it may be that wee thing's already implanted there. For example, I'm maybe not so much now, but certainly when I was younger, I always needed to go to the toilet. Wherever I was, I would usually go to the toilet. And even now, in honesty, I probably like to know where the toilets are. And sometimes just that is enough. Even knowing where they are is reassurance in itself. And I don't need to go because I know where the toilet is. But if I don't know where the toilets are, or certainly in the past, if I didn't feel I'd be able to access the toilet easily, so if you were in the middle of a row in the theatre, or in the inside seat in a plane or something like that, where you couldn't easily get out to the toilet without having to disrupt lots of people, then I would surely need to go to the toilet. And if you think what happens then, if you think it's similar to when we've talked about pain as well, as soon as that thought's in your head of, oh, what if I need to go to the toilet, then there's an element of fear. It's maybe a bit harsh, but under the umbrella of of fear, a wee bit of anxiety, a wee bit of hypervigilance, oh, you're noticing, well, I'm going to the toilet now. You're bringing your attention to the fact that you need the toilet. And so it all goes on from there. And it can quite easily escalate. In addition, not going to the toilet when you need to go in itself is perceived by the brain as a danger signal. So if you need to go to the toilet and you don't go, I'm not talking about the second you need to go, but if you're needing to go and you're holding off because you're busy doing your work or you're wherever you don't want to go for whatever reason, then that actually sends the danger signals to your brain, which puts things into a higher state of alert as well. So in my experience of working with people with bladder issues and having had my own bladder issues in terms of, I don't know what you would call it, urgency, maybe frequency, don't know, probably frequency, probably more frequency for me, because I say it was a case of, I had to go in a hurry, but I would always be kind of thinking, oh, might need to go. It's a very complex thing because there's a huge psychosocial aspect around that in a different way to pain. And obviously, as I mentioned earlier, often when people do have sensitive bladders or reactive bladders or interstitial cystitis, they also have pain as well. So if you imagine you notice you need to go to the toilet and then you get significant pain as well, and you need to go to the toilet and the pain is ramping up, and the more that ramps up, the more you need to go to the toilet, and then the more the pain ramps up. It's a very, very difficult, challenging and debilitating situation to be in. And it's probably something that really restricts people massively in their lives. It can stop people going out because, again, they're concerned they're going to have to get to a toilet really quickly, interfere massively with their work, interfere massively with their social life, even if you're not out and about, if you're either at a friend's house or people visiting you and you're constantly worried about having to go to the toilet. If you've got pain in that area, it's a very, very debilitating situation. But just like we've said, with most persistent pain situations, most situations of sensitive bladder, overreactive bladder, irritable bladder, and interstitial cystitis are all amenable to the same approach that we take to persistent pain. They're all amenable to retraining, because as we've talked briefly about there, so much of it is around how we respond to it and how the danger signals and the fear ramps up, probably even more so than often it does with different pain situations. Very much danger and fear and hypervigilance around the bladder. As you can understand, it's a very emotionally sensitive area as well. So as I say, it can be massively debilitating for people, but from experience of working with other people and also with myself, it is absolutely solvable. We can totally get it under control using the same approaches. It is absolutely possible to get things back to normal, to get back out and about, to do the things you want to do without really being tied to the safety of a bathroom within reaching distance. It's absolutely possible to do that because, again, there's no structural problem there. It's very much how we're reacting to the sensations that we are getting and that the brain is interpreting. So I hope, again, that gives you a wee bit of an insight into things that aren't just pain, as they often pain will go along with these other things. But the primary thing someone will probably say they have, if they've got a sensitive bladder or an irritable bladder, or maybe it isn't pain, they might be talking more about the frequency and the urgency. Often there'll be pain there as well. But it's just to raise the awareness and let you know that these symptoms, we can use exactly the same approach and we can absolutely get them under control and get them resolved. Okay, so I hope that's of interest to you. As always, I'd love to hear from you, so feel free to send me a wee email, hello@carolineeson.co.uk, and I'll see you again soon. Okay, bye for now.